Good morning, Gerald 508, June 27th, the last official lecture. Wow, we only had the bonus lecture later, and you guys do whatever you want on that one. So this is great. We had a really good discussion about depression and addiction. Again, you know, people think addiction is the area of concern for young adults, whereas it's a huge problem in the older adult population. So thank you, Tab and Wu, for bringing up such a great topic. So now, continuing on with this discussion, part of the reason for the addiction is the aging process and the likelihood that you're going to be prescribed lots of different pharmaceuticals. And one of the pharmaceuticals in discussion is sleeping pills. Okay, so the benzodiazepines, which are very, very addictive. People have pain and they're given the opiates. Very, very addictive. Okay, so and then what happens is oftentimes there's polypharmacy, where you have sleeping pills and pain, and you mix the benzodiazepines, the Xanax, the Valiums, with the OxyContins and codeine and things like that. And then you can combine that with alcohol, and you can see that this is a polypharmaceutical disaster. Okay, so great topic. Susan's done a wonderful job in putting out some really, really neat questions. Have you ever figured out aging sucks? And so the likelihood of taking multiple things to treat your problems goes up and up and up as you get older, and you can just see that in this chapter. Alrighty, so one thing that Susan brought up definitely is the role of the FDA, okay, and in approving drugs, and this is very, very important. You know, are too many drugs fast tracked, and then the ones that are really, really important sometimes linger just because of some bureaucratic BS, or because of a study that affects one small segment of the population and not the other. So a classic example of this is, as I indicated, my wife has a pretty severe case of Sjogren's disease, which had resulted in an autoimmune attack of her vagus nerve that innervates her stomach. So she has dramatic gastroparesis, and so to balance out the autonomic nervous system innervation in her stomach, you have the parasympathetic and the sympathetic. So she has too much sympathetic overload, and so you need to take drugs to block the actions of dopamine. And so the best drug out there is called domperidone, okay? But it lost its FDA approval way back then because it was used to encourage lactation and caused some problems in terms of women if they had not given birth yet. Craziness, okay? So why don't just write that on the label? So no, you can't use it. So she has to order domperidone from Canada. Because the only other drug that is out there for treating her condition, and her condition is severe, is called Reglan. And Reglan, unlike domperidone, goes up and passes the blood-brain barrier and gets into your brain. And what it does is it causes permanent tardive dyskinesia. And you've seen people that have tardive dyskinesia. They have this uncontrollable writhing motion in their mouth, where they're just going like this all the time. So Reglan or domperidone. Domperidone cannot pass the blood-brain barrier. It goes up and boom, goes down and acts on the stomach. Crazy, okay? But that's what we have to deal with. Okay. Another issue that I actually brought up in email discussion with Susan is we don't have physicians that are often trained. They just reflexively trained well. Reflexively will prescribe drugs like hypertension medication for the elderly. And I just went through this with my 92-year-old mother. She had a new doctor. I said, fine. She went to see him. He was worried about a little bit of swelling in her legs. He thought he heard a heart murmur. So he threw her on all these different medications simultaneously. Okay, so she had a little bit of back pain, so he gave her a muscle relaxer. He gave her Lasix to get rid of the swelling. Okay, And then he put her on propranolol for hypertension because he thought that was contributing to the swelling. So what happens? Okay, so you lose blood pressure from Lasix, you lose blood pressure from propranolol. She gets up in the middle of the night, boom, she falls and hurts herself. I wanted to kill the idiot. Okay, so then I immediately took her up to Keck. We went to see Dr. Dongwa Kim, amazing geriatrician. She took one look at the medication and said, I feel so sorry and feel so bad about our medical community. So she immediately took my mom off this medication, and now my mom is doing great. So, classic example. Dr. Ed Schneider from a gerontology center is running a huge study where he's going through elder care facilities, okay, assisted living facilities, and looking at 90-year-olds that were prescribed hypertensive medication in their 60s, and they're still taking it. Okay, and what's happening is they're having falls because of the orthostatic hypotension that happens naturally when you get older. These are big issues. So, okay, so I think that's it. I heard a knock on my door here. She's gone. Maple was scratching at the door. Okay, she gave up on me. So, great discussion, great class, and let's put our best foot forward and do a great job on those papers. Okay, so here she is. Wait, come here. Say hi to everybody. There she is. That's a good girl. That's me. So, see, she's part of the senior crowd. Okay, bye-bye.